Welcome, everyone. Welcome to Dealmakers Table, the healthcare series. Today, I do have Tom Farley on. Tom, thanks for joining us today. You've got a real unique and deep personal connection to the world of recovery.com.
Well,
Maybe
thank
could you
you. Thanks
start,
for having
but
me.
yeah, maybe you could start by sharing a bit about your journey and how it led you as the role of the
Yeah.
outreach director at recovery.com.
I can't believe it took me this long to kind of find the right pew, but it took that whole journey to get there. So, I'm here. So, yeah, I mean, I started I grew up in Madison, Wisconsin. Um, and with the there were three boys and one older sister in our family, and in this crazy environment, I what I like to say is that we check three boxes in our family. From what I understand now, after being in this field, have a pretty long family generational history with kind of poor relationship with alcohol, uh, and so we had that box. We were Irish, and then we lived in Wisconsin. So in all three of those categories, drinking was very normative. As a matter of fact, it was part of our identity. If you were a Farley, you drank. If you're Irish, you're supposed to drink. And if you're in Wisconsin, I don't think that story's been told. Everyone kind of knows what goes on here in this state. So, I really only needed to check one box, but I checked all three. And, uh, and again, thinking that all of this was very normative. And, it got me through to college. I went out east to college and I didn't think I probably stuck out as nearly as much. I must have. And you know, moved to New York, and I had this. I was on this pace to be, because I went to Georgetown. I had to be this ultra, competitive, high achieving kind of guy like everyone else that I went to school with, and I I tried to be that. What I thought was expected of me, what I would expect of myself. So, and it just didn't feel right. I was in marketing, which was creative, but I love that. But I was in financial services marketing. I hate math. I don't know why I ended up in New York, but I did, and then followed a few years later by my brother Chris, who came to New York in a completely different capacity. He got through college and said, I want to go into comedy," and I was like, I didn't know that was an option. So it was fun when we were in New York at the same time. But also, I was, with the rest of the family in Wisconsin, I was the first responder to watching Chris kind of struggle with these issues, um, and then dying from this disease. It was at that moment that I realized I did something very, unlike, very un-Midwestern, very un-Irish. I knew I needed to talk about it. There was too much, grief and um, on this loss, and so I went out and into schools as an advocate for prevention at that point, but really just talking about somebody else's story and somebody else's addiction, Chris's. I'm sure I helped people, but I was still struggling with my own issues. There were times when I said I probably shouldn't drink either. So I would have long stretches, 4 or 5 years of sobriety, only to have all sorts of, these train wrecks in my life that just didn't stop. And I couldn't figure it out. I thought I was doing the hardest thing, I could do by not drinking. So, and then, I finally, I would not drink and then have longer stretches of drinking. And then this last, about 7 and 8 years ago, I'm like, now I'm getting old and I'm not doing something. It just doesn't feel right. I shouldn't drink. And I did kind of what I had always done. I just stopped, and it's funny, all those times before I would go to AA meetings because I thought, well, I was told that you should do this. And I would go in and it was just like we did with Chris and our family. I could always point to somebody across the room sharing their story. I'm like, well, oh my gosh, that I don't that I'm not that bad. That guy drinks more than I ever did, and that guy over there takes drugs and they took drugs and they drink. I don't belong here. And we did the same thing with Chris. We looked at him and said, because we didn't want to be honest with our own issues, we made it all about Chris and his problem. Because, we're not that bad. We don't have a problem. But clearly we did. The whole family did. And that's why we're all sober now. Um, so but this time I went back. Somebody brought me somebody that I really respected in this field, and it brought me to a meeting, and I started to listen to not how much people drank, but I'm like, oh, I've had broken relationships like that person. I've had job loss like that person. And I started to be, really, as we say, rigorously honest with myself. And that was my journey into recovery. And once I got into to recovery, I took all this work that I'd done going into schools with under the Chris Farley Foundation banner, and I kind of switched from prevention more into to treatment and recovery. I just felt like talking to people, that I felt I wasn't far removed, and it's almost like I wasn't just trying to help them. I was trying to help me too, and I started to put myself in more and more situations where I'm working with people and either in treatment or in recovery, and then I got this position as an outreach person for a treatment center in the Midwest, and it felt really great, helping people get into the treatment that they needed. But even then, I always felt like I was just trying to get people into our place. I was just trying to, just business development, for our own treatment. But I would see people that, either didn't go to our place or didn't, had other issues that wasn't right for them. And it just, I just felt like there was more. And then this I met these people from recovery.com that were the startup tech company that started in my hometown of Madison, Wisconsin. And I now, get to help people into wherever they need treatment. And now it just felt so right. And at the same time, uh, they allowed me to do that to talk about their messaging and what they're good by using my story. And so now not only do I get to talk about recovery.com, but I get to do it by telling my story and being honest and vulnerable. And what I like to say is every time I talk to a group, I'm also I remind people like what you're really seeing is me healing. And so I get to model that too. So yeah, it's been a crazy journey. Um, but now I'm at a place where the internal culture, fits who I am, and my job, the mission is aligned mission wise. But the icing on the cake is I mean, I get to, heal and continue on my journey, it, you know, in this job. I don't have to, go and punch out at 5 and then work on that all that stuff. I get to do it
No,
constantly.
that's great. Thanks, Tom, for the really good, robust, in-depth, background, backstory. Growing up in the Midwest, I can certainly attest to the rampant, alcoholism and drug use. Growing up in North Dakota, seeing the oil field boom and bust, there's also
Yeah.
some drug utilization and a lot of addiction there. It definitely goes under the radar for far too long. Really do appreciate your openness and vulnerability here to make it less of a stigma and maybe, open some people's eyes to there's a world past, this addiction and there's a recovery pathway. So, if nothing else, we get one person listening to this podcast doing
Yeah.
something about it, then we have achieved something good for that individual and hopefully more individuals. It's great that your journey took you along a path of healing as well as from a
Yeah.
smaller, sphere of influence to now what recovery has. It's recognized as, one of incorporated 5,000 lists, signifying a huge, significant growth and impact. I guess when you got involved with the group and the team, what was your initial vision behind? I think you already talked about some of it behind recovery.com and the problems that its founders were trying to solve in the addiction and mental health space. I think you mentioned they're trying to go past just the original, treatment now. They're trying to extend it further. So can you lend any additional insights to what the team and the company is
Yeah.
trying to do for people who need this help and service?
So when I met them at a industry conference, a couple years before I joined, when I was, working for this other treatment place, I loved it because they were Madison based and it was technology and they were innovative and they're disruptors. And I liked all that stuff in finding treatment. And I loved it was created to kind of break down barriers to treatment, helping people really find that. And so I kind of kept them in, really close touch, and I wanted to continue to follow up and see how they were doing. And then I finally was going to do a. They asked me to be on a as part of their first marketing summit. How do we market treatment in healthcare? And I was on a panel, and just when they did that, they had spent a lot of money. This little startup spent more money than they probably had to buy the domain name recovery.com. We were called Rehab Path before, and we had all these other, domain names, and like they just pulled the trigger, said like, we need this. It was for sale and we bought it. And that's when I sat down with the two founders and they explained it's like, this really help with our mission, and really kind of clarify what we're in this, help people find treatment so that they can realize this promise of recovery. Said they got that, but they also at the same time, and this is when they told me it's like, but we also realized, oh my God, we just bought the domain name recovery.com. Like we have to like honor that and be that. And treatments, treatment, you get 30 days, 60 days, whatever, but recovery is the rest of your life, and we got to be that too. And as a person in recovery hearing that, and as a marketing person, I'm like, yeah, that's what you want to like. I want to. I have to now. I have to work for you. And they said like, and all that. But we're a tech company, and we're really not good about getting out in front of people and with our message. And I'm like, that's all I know how to do. So this is a perfect marriage. Like let me do this. And so as we kind of really really work on this original, help people find treatment. There's this whole recovery side of things of um, really selling that message and then growing it to. And I've been saying this, in my talks for years, like one of the most wonderful things about this industry, the real growth areas are sober living and peer recovery. Those are really growing fast. And the reason why I like it is because traditionally, when you went to treatment or a family member went to treatment, you went away to treatment. And your community, your family didn't have to worry about you at least for 30 days, and you were out of sight, out of mind. And hopefully you came back, different. But these two areas, sober living and peer support recovery, those are things that are done in our communities where people get to see people heal right before their eyes, and and stigma starts to really break down when you see like, oh my God, like not only did the community write this guy off, or his family wrote him off. You could tell that he wrote himself off, and now he's doing this amazing stuff in our community. Like, and people are seeing that and seeing what it is. It's an amazing thing to see a healed human. And so those two things, the areas, really allow that to happen. So we're trying to build back, in not just treatment, but helping people find outpatient, helping people find sober living options, finding peer support, all those things that are important part of recovery.
Oh, that's awesome. That's nice to hear that, the company is looking at end-to-end treatment, not just a piece of
The
it,
whole
but
journey.
yeah,
Yeah.
yeah. No, that's fantastic. So that kind of leads into the theme of the podcast today is, rethinking, how we get more people involved in recovery, right? I mean, that's really what it's about at the end of the day. And there's different ways and strategies in which to do it. And you mentioned that, recovery.com was created to break down those barriers in treatment, right? Get rid of the stigmas, make it, okay, normalize it. It happens, right? It's out there.
Well,
So,
yeah, go
oh,
ahead.
yeah. So can you maybe elaborate on,
Yeah.
the traditional inefficiencies and, what the team and the company is trying to do to address that?
Well, as wonderful as, offering, treatment and therapy and help as it is, the model was still created by, you know, and a lot of the referrals, a lot of, the business development was based on, who's got an open bed or, who's in our network. It's driven by insurance, payment, and it's driven by availability. And so, um, it's not, it's built on what is the need of the provider, people, either paying for treatment or providing the treatment. Like, what are your needs? And let's try and, make it so you're successful. And what we're trying to do with this site is really shift that to, it's really patient focused. It's really like, what do you need? And not only that, and not only, is, like, what does this patient need? But also, um, so it's really, what I like to say, when you went to treatment, you're really pushed into treatment. Your family says you need a treatment. Your doctor says you need treatment. Maybe you had an intervention, and finally you go, okay, I'll go. And it's mostly, it's not true acceptance. It's mostly compliant. It's like, okay, I give up, and you go, and you're not really sold on it, and that's why you get people going back and back and back and relapsing and stuff like that. So what we're trying to do by creating this patient focused, what do you need approach, it's really, building agency and ownership of this disease that you have, and once you do, and you're like, oh, okay, yeah, this is not good for me, and like, you go into, treatment or any kind of therapy with that kind of, power and agency, and then success does follow. You're gonna want this, from the get-go, and that's kind of what we're trying to give people, not just here's your treatment options, but also all these resources that, are back end of, like, what does my what can, insurance pay for, or what is DBT therapy that, my doctor keeps telling me I gotta have. Like, what is that? Like, well, like, find out. Hear people's stories. Start to feel that you're not alone. You know, and I will say one other thing too is, it's also really, it's understanding the mindset of people that need, treatment or go into treatment, or start down this path of recovery, is we are, because I'm a person in recovery myself. So as I said, like, I saw this right away when I got into the treatment space. It's like, do you understand how we're wired? We are hyper focused on that one moment where we can say, "Ah, see, I knew you didn't want to help me." We're just waiting for that. Like, well, we have a waiting list, or you're not in our network. You're like, thank you, I tried, now I'm done. And so what we're trying to do with this website is really address that, like, not allow that to happen. Like, we care about what you need, and we're gonna that, try to eliminate those barriers, uh, right up front, so you don't say, yeah, yeah, I knew it.
Yeah.
And yeah, that, I mean, that's a big one.
Well, when we talked, and it sounds like what the site and the mission is trying to do is, break down the defensiveness, break down the barriers, empower the individual to say, hey, you know what, here's my specific needs. And, when we talked earlier, Chris, I'm sorry, Tom, when we talked
No one
earlier,
ever says that to me.
I
All
said
the
that I
time.
wasn't going to do that, and I just did
I
it.
know, and that's why you do it.
All right, now that that's out of the way, we can move on.
That's so good. I was waiting.
Apologize.
No,
So,
are you kidding? You don't think I get that every day?
yeah,
I
I'm
love it.
sure.
I love it. It's
I'm
it's
sure.
it's it's
But
it's I don't know.
but when you were explaining it to me, I said, Tom, I don't get it, right? What does the site do? And you use this analogy that it's the trip advisor for
Yeah.
treatment. So can you walk us through, how this is more, it's more than just, a directory. Help people understand what resources are available to them through the site and through what you have to offer and the team has to offer folks.
Yeah. It's like, I mean, that's kind of the new thing is really, um, it's really incorporated this, yes, we can find you a place to go on your vacation. Or like say there's another one is car gurus. Yes, we can help you find a car, but we can also help you understand like what kind of car do you need? What kind of place are you looking for? Like what activities do you need in around the area and really providing all those, not just, booking a hotel room, but also like making sure that when you get there, this is the greatest experience, you know, um, that you were looking for, and it's because we took the time to really find out what it is you need, and so that's what these sites do, and I would say another thing, it's almost like yeah, I'm going to say Yelp, but it's Yelp is kind of the Wild West, but it's also like what are other people's experiences? What are other people's stories? Not just about this treatment center, but about recovery in general. So it's all this content that we're trying to build around finding the help you need that really it makes you feel like not only am I getting help, but it's they care about me. There's that empathy that we're all looking for,
No, and telling the personal stories, breaking down the stigmas, I think that's key and critical. And you started off with your, introduction just like that. I think that's going to be huge and making the bridge of people realizing that they need help and using the services that are available to them. And there's also, I know that you mentioned you've seen some manipulative practices, maybe with other nefarious, sites or things of that nature that just they're just out to make a buck, right? They're not seeing the person as an individual who needs that treatment, who doesn't want to, you have to take that defensiveness away or the, hey, the bad stigma or the bad experience. Like, okay, I tried, but all right, you blew it. You provider blew it for me. I'm out of here. I'm going to go back to my
yeah.
own ways. And
So much damage can happen that way. Yeah.
yeah, and the site just recently you created a blue check verification, right? Can
Yeah,
you create
verified.
it? Yeah, tell us a little bit more about that if you wouldn't mind. And what does that
So,
mean to people?
well, to be on our, first of all, on our site, there's a lot of different levels, as base, like we want everyone on our site. So everyone that we can find has a free listing. It starts out there like you're on, and not just a free listing, but your profile. We build these profiles. We have people in Madison building these profiles for these treatment centers, and we call it you're claimed. That means first of all, we found your site and we put it on on the website when we've got it on our site. Then we contact them and say like, do we have the right picture, do we have the right description? Let's work with you. And this is all for a free listing on our site. Sometimes it looks better on our site than their own website, because fact of the matter, their lane is treatment, not marketing and not all this stuff. But yeah, we can help with that. And so we start there with this, claimed, making sure that you look really good on our site. And on the other end, we do have advertisers. Like when you search on Google, the first three listings are sponsored, 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 and it's really it's just awareness. It doesn't, they're on the top of a page, but the rest of the list, you don't get a better listing, by paying for it. Everyone, gets you know the listing is it's based on clicks and things like that. So that's on that side, and they get a little bit more exposure. Even there we restrict people to you can't be on every page that somebody's going to click on. If you're in the Midwest, you're going to be you can advertise on our site on the Midwest pages, not globally, wherever, just because you're nationally. So we do that. And then in the middle is this thing called verified, which it's kind of a hybrid of this thing. And not everyone can be an advertiser, but we can offer that we want to like really showcase the good players, and we do this work, with these people that get the best pictures, the right side, and really get to know who's on our site. And so for a lot less money, not only do they get this blue check verified, but there's a thing called legit script that is kind of a universal thing that if you're in this space, of healthcare and things like that, uh, it's a algorithm, and I'm going to throw out tech terms I know nothing about. But anyway, it really it keeps people if you're going to talk about things, it keeps them kind of verified, and if you're saying things that uh, aren't true or whatever, it kicks you off. Google, if you're not don't have the legit script uh, um, kind of sign of approval, then you're not gonna get very far with your SEO and things like that. So with our verified, we give these smaller players that maybe can't afford the investment in legit script. Yeah, that's part of we give that, we let you have that. If you're on our site with a blue check verified, you get that legit script too, and so you get to play in the big pond. Um, because you're just doing it right, and we're acknowledging that.
Oh, that's great. And really to help out some of those smaller providers too,
Yeah.
because like you said, they don't have the money. They don't have the means to,
And
you
yet
know,
they're doing the amazing work, in their therapy, and people we need to help people find those,
yeah.
and there's so many out there. They're great. They're wonderful. There's treatment out there for everyone,
And that's one of the things that I really admire about the team and the company is not only did you go and buy recovery.com, but you also took basically gobbled up all the bad domain names and just said, well, you're not going to use these things
Well,
so that people
right.
don't go to nefarious actors. How has that maybe impacted the strategy and the overall mission? Have you seen
Well, yeah.
more of the right fit for the right people and the right organizations to provide them support?
Sure. Well, first of all, as you said, it cleaned up at least started to in a small way. It cleaned up, and we did a lot of work to bring them on board. Um, but it also showed the industry and the associations in the treatment field that we are more than just a directory, because at first blush that's what everyone thought, but they're like, oh no, we're taking hard-earned money and investing in the industry and helping people do this. And so there was that, and really, showing that we are walking the walk, not just talking the talk. But at the same time, when we purchased these domain names, you know, we doubled the amount of people that were coming now to our site seeking help. And that's that's so many more people that we are able to help that weren't finding the right help before. Now they're on our site, and so I got to tell you, and we even talk about that in our marketing meetings at recovery.com, yeah, we talk about clicks and likes and things like that. But every time we do that, we always remind ourselves that, like, hey, you know what? Every one of those clicks is a human looking for help, and we don't lose sight of that. It's not a marketing term to us. It's like we're helping people, and to be in meetings, talking that language is pretty incredible.
Yeah. Yeah, having spent 30 years in the biopharma industry, right? That's one of the easiest things that gets you up in the morning. You're helping people, right? And that's what
Yeah.
you're doing here too. So I guess looking forward, what are you and the team looking at doing in the next 6 to 12 months, right? To increase that outreach, right? So you're just talking about doubling. So, you're going to quadruple or, 8x your acquisition strategy or,
Well,
how can,
yeah,
what are you doing to get
yeah.
more patients and help more people?
Um, well, one of the things is another thing that we create these little things like what we recently created a widget, this URL, a bar, a Q code or whatever it's called, um, that people can put on their site that people can click on and go right to our site. So other so doctors and things like it's this like find treatment at recovery.com. So it's just creating these using this easy technology tools to help us grow. But also we have this another whole kind of focus called recovery.com Pro, which is really focused on uh, the physicians, therapists, clinicians that are out there doing work in an outpatient or even in a hospital, or even school guidance counselors that that this isn't their they don't know everything that's out there. That like, most of the times they have a folder that somebody from outreach that this is how I used to do it, walked in and gave them, or they look on what's in this person's network. So this, recovery.com Pro is really focused on the professionals that are looking for, additional help. Like they're a primary care physician that like, it's not just kicking the can down the road to who's in um, in your network. It's like this physician knows this patient better than anyone, their health history and all that kind of stuff. So we're giving them the tools to make, to continue to help that person when they need, treatment um, uh, and therapy help. So
What a
so
great
it's
resource. Yeah.
yeah. So we're
Yeah.
trying to do that. We're still trying to grow out, wherever we can, as I said, the sober living, the peer support, even finding meetings. There are a lot of meeting finders everywhere uh, that are really good, and again, and we're fine, and I think what our approach is to not compete with those people or compete with the other sites like ours that are out there doing great work. The good ones doing great work. We're like, how can we make each other better? How can we partner so we're trying to build these strategic partnerships that it's not about competition. It's about uh, who's aligned, who else is aligned with this mission that we have to find helping people find treatment. So
Right. Yeah.
it's really you're growing strategic partnerships using these new tools and understanding that more and more people are looking at the internet to find help. And we need to be that a resource for them. The demographics now is changing rapidly on us, and we better be there to meet them.
Right. Well, your work there is, clearly making a difference to the folks that need it. And I know, the mission is serve everyone who needs to be served. And for anyone who's listening, like we said at the beginning of the podcast, who may be seeking help for themselves or a loved one, or a healthcare provider looking to find that partner, it sounds like recovery.com Pro is a good resource for them.
Yeah.
You obviously go to www.recovery.com, the website. And is there anywhere else, any other resources or ways for them to contact the team?
I think, well, first of all, if you're a treatment provider, like, see if you're on our site, and if it says unclaimed, there's ways that you can you can contact us, and make sure that we have the right information, and really help us help you, like, and, we're reaching out all the time, but if you're, find us on your site, you're gonna be on our site, but it's, it's your treatment center or outpatient clinic. So, like, let us help you, and we don't want to have the wrong information. So find, find that if you're seeking treatment, if you're a family member, particularly, not just somebody, that needs treatment themselves, but also family members, which is a often forgotten, uh, kind of the next rung out. Uh, Look at our resources, educate yourself, and really get beyond that shame and stigma that I know we had in my own family. You know, I know all about that, and so it's wonderful to be able to talk about, not just my brother, but also my journey without this shame and stigma that we this that we're under this cloud that cloud for so long, and it feels liberating to be able to do that. And I tell families that too, like, but, start on our site, listen to people's stories. Like, we're really trying to, break down, build that empathy, and deliver our message through our content, through our we have wonderful podcasts, people's, telling their stories, all those things. So, um, it's not just a, find treatment directory kind of thing. It's really, it's about that whole recovery journey, and about, that the promise of recovery, finding that, and as I said earlier, you're pushed into treatment, but recovery is this pull, and this is what I talk about all the time. It's like, I don't talk about where I've been so much as I talk about, like, I have this life now that you couldn't have told me I was gonna, have in recovery. And I tell people that all the time. It's like, vulnerability, and honesty is a little painful at first, but then it's not. And all of a sudden, oh my God, I'm not alone anymore. There's other people that share, that, my journey sounds just like theirs, and this world of recovery is, it's amazing, and I hope people, and I know people will eventually, find that on our site too.
Well, Tom, thank you so much for being on the podcast today. Do really appreciate your openness, your vulnerability, your sharing, and your caring. And that's really what it's all about at the end of the day. So, with that,
Yeah.
we'll call it a wrap, and look forward to seeing a whole swath of people coming your way.
Yeah, yeah, and thank you for doing this, and really, because it's a very important conversation, and we're not the only ones out there, trying to kind of change things. So, continue the conversation, and I think we can change this. How we're doing treatment and recovery, and we
Absolutely.
learn tomorrow.
And looking for bigger and better things to come. So looking forward to seeing those
Thank you.
changes come through from yourself and the leadership team. So with that, have a great day, everyone.
Thanks so much.